Welcome to the Paradigm Concept, where we explore technology, innovation, and the people shaping the future of oral health, business, and wellness. All right, welcome back to the Paradigm Concept. Today I'm excited to talk about one of my favorite topics, which is building something from scratch. And we have the perfect guest today, Dr. Mirela Memic, who has recently opened a practice from scratch in the Atlanta, Georgia area. And Mirela has a just fascinating background, a blend of military service, motherhood, and, starting a new practice, a new business. So thanks, Mirela, for being here today.
Thank you so much for having me. This is one of my dreams, so I can check it off my list, I guess.
Well, I hope it doesn't disappoint.
Oh, it won't.
I always love learning about people, and I know you have a super interesting background. I'd love to kind of hear about what brought you to this point.
Absolutely. So I'll kind of start from way long time ago, but I'll get through it quickly. I'm an immigrant basically from a war-torn country, Bosnia, former Yugoslavia. I grew up during the war, so that was a little challenging, but kind of towards the tail end of the war, my mom had us pick out a dream, and mine was to be a dentist and a soldier. So fast forward a couple of years later. It is, absolutely. With the war starting, I just felt like the women weren't doing anything except supporting the men. So I said, I'd like to go fight. Why can't I go fight? So then we immigrated to the United States in the 1990s, actually here to Colorado. So I actually remember the first time I got off the plane here. And yesterday I got off the plane here again. And it was a much different experience. And I can thank you for that. But I kind of kept that dream going, and then went to dental school here in Colorado.
What was it like? You said it was a much different experience. What was it like the first time you flew to Denver?
Okay, if you want to know, I'll tell you. We got off the plane and were placed in a refugee house, a 2-bedroom house with another family of 5. No food. We were waiting for our food stamps to come in, so we had to share a tomato. There wasn't a second tomato for me to eat, and I vividly remember that day when I couldn't have enough food to eat. And look at me yesterday walking across that stage and hanging out with you guys. So this has just been a full circle for me. It's been absolutely wonderful. So went to the University of Colorado for dental school, and then went to the Army for my training, completing my little vision of becoming a soldier and a dentist and eventually an oral surgeon. And then got out of the military after 12 years of service because it was time to take command instead of do surgery. And I felt like surgery is where my heart was. So I went ahead and settled in Georgia, Atlanta, and after my boards, heard about you guys, heard about Paradigm, and really researched it, went to one of the meetings, and that was my next dream. I wanted to open up a practice.
Nice. I think it's super interesting. I just had a talk with Hamza Al-Atassi, and similar background, grew up from a war-torn country, and I feel like we've had so many people that have immigrated to the United States that are surgeons in our group, and I like to think we have a pretty exceptional group. So I think that might be part of the formula for success. Obviously not everybody overcomes those types of things, but it must be something that really shapes somebody and helps drive them and realize that things can be a lot worse and overcome amazing things.
I also think it shows you the importance of what life is about, right? Life is not about money and luxury and all these things that we have. Life's about doing the right things, having fun with them, and enjoying life. And another reason why I can't wait till we start talking about the de novo, because I feel like I'm finally in that part of my life where I'm enjoying it and enjoying work. And I think what we have to offer here at Paradigm allows for that.
So like building up to, starting your practice, like going back a little ways first, your training in the military and things, how does that sort of shape your learning?
So I'll tell you what, not to be offensive to anybody who hasn't gone into the military, but it really builds discipline. You understand what it's like to show up 15 minutes early and still be late. You understand what it's like to be woken up at 5 a.m. and have to do a random UA just to make sure you didn't do anything bad over the weekend, right? You understand how it is to ask permission to travel, even though you're paying for all the travel and you have time off, but you still have to ask for permission, okay? So it's stuff like that that really shapes you as a human, because it teaches you responsibility and it makes sure that you have accountability for everything that you do. it definitely helped me with that because I moved from my parents' house into the military. So it was a nice transition from full control by my parents to full control by the military. Um, as far as skill-wise, the nice thing about the military, training in the military truly, is that there is no financial component to patient care. Right.
Yeah.
So we got to do a lot of surgery. Whatever is needed is done. And it's done to a very high standard because the military is able to have funding for the soldiers for any surgery that we deem necessary. So that was really, really fun and rewarding.
What was your role? Where were you stationed and things? How did your career evolve there?
So I was at Joint Base Lewis McChord for my training, and I was there for 5 years. And then after that, I was lucky enough to get stationed in Germany. So I was there for 5 years, and I covered 5 military bases, solely just me. Luckily, I was not a mother at that point. I was single, and all I wanted to do was work. So I pulled call 24/7 for 5 years, and then did my big trauma and orthognathic cases. I did those at Launch Tool Medical Center. I'm sure a lot of people have heard of that one.
So you did lots of trauma and reconstruction and things?
Yes, sir. And I would travel 4 hours for that operating room, taking my soldiers with me. I trained all my assistants. I trained all my staff. And I set up the program in Germany.
Well, as the story evolves into your practice, I think those are all probably really important things. Train your team, sort of building some camaraderie and loyalty and things. And I think you also met your husband in the military.
I sure did. In Germany, in the middle of Germany, I picked an American soldier who happens to be Mexican. So why not, right? When in Rome. He's absolutely wonderful, and he's been an asset to this practice as well. So everything has kind of
built on one another.
Exactly.
That's awesome.
Yes.
Well, so I guess about a month ago, maybe you opened the doors to the practice in Buckhead.
Believe it or not, it was in July.
So, oh wow! So
Can
a couple of months ago.
Life is flying by. So July 15th, again, one of the happiest days of my life, I got to open doors to my practice, which, as you know, I've been waiting about 2 years because I had some prior obligations that I had to kind of fulfill. And it was ready for me on July 15th. I had my little opening ceremony.
It's a beautiful office.
Oh, my goodness gracious. It's gorgeous. And it's in the perfect location. It truly is. We have great parking. We thought of everything when we were picking the location. And the build out was very nice. It was very successful. It was right on schedule. So everything kind of just fell into place.
I know the first, you're a pretty ambitious person. I know the first few weeks you were a little frustrated that it wasn't busier, but I feel like you're ahead of the curve really in terms of, how I've seen, things growing in your practice the past few weeks here.
Yes, sir. It's not easy, I'm sure, but with so many openings, I feel like I can text you at any time, and that's a big deal to me. And I did text you my frustrations, and just you saying it's okay was a very big deal to me. So I do want to personally thank you for that.
Oh, yeah, you bet. No.
I had a vision of opening doors and having 1,000 patients a day because it made sense to me, right? Because I've never marketed before. I have never opened anything up from scratch. So, you can prepare yourself as much as you can, but when reality hits you, it's almost scary because I did not want to fail. I didn't want to fail you, and I didn't want to fail me because I know what I'm capable of. And so that was my frustration. It had nothing to do with the actual, place and the business. It had to do with me internally, myself. I will tell you that we have ramped up significantly just over, 2.5 months, and that we're heading into very big cases next month. So nice. I think that's fabulous and phenomenal. And looking behind me, it wasn't magic. It was a strategic flow of time, a coordinated effort that had to occur. And yes, I wanted it in one day, but it doesn't happen in one day.
Yeah, there's so many things to do. It's it's the whole, you have to bake this cake of perfection, all these different pieces. And it does take a little time. Now, I think we found surprisingly, it doesn't take that long, but it's kind of like residency every day, like lasts an eternity at the start when you're like, come on, let's go. Why aren't my assistants better trained yet? Why aren't, and suddenly you're leading, you're the boss of a whole lot of things,
right?
That is probably, exciting, but a little bit different.
It is. And I will tell you that I kind of see it this way. I wanted to get a castle. Everybody does. Why not get a, Dave Rallis makes me a castle and gives it to me. That sounds awesome, right? And I just walk in and, no, you gave me the bricks to build my castle, and it's mine, and it's the way I want it. And I appreciate that so much, because these last 3 months have shaped my practice. I made it what I wanted and what I am capable of holding up and taking further. And again, it's not something I expected, and I didn't know it was going to be that way, but I am so proud of it.
I think it's, we have models for all these different things, and you can sort of put them in place, but they're only, as effective as much as that fits that doctor's like desires and personality and everything. So I think it's really awesome to see practices and cultures and teams evolve, because like no new two practices are ever the same. And I wasn't in the military, unfortunately, but I love that sort of like, I always thought that you could do, perfect something and do it one way, and everyone would have to do it this way, and you do it 1,000 times and it would be that way every time. And I've learned over the years that just never happens. It's like we have to rapidly iterate and change things, and like change is the certainty. Like things are always going to change, and how can we just change faster
Right.
and better?
But two things that you have to keep in mind is you have to have a balance. If you give people no structure,
Yeah.
if you just told me, why don't you go ahead and open a practice in Buckhead? Okay,
Yeah.
that's a
And it's
bit
a
too
pretty
much freedom.
pretty competitive place too for you.
Exactly. So, you have to be reasonable, give people enough structure, but also give them enough freedom to grow. And I think you've found pretty much the perfect balance. Nothing's perfect, but it's pretty much the perfect balance of the two coming from my side. Secondly, you're talking about innovating and changing. I think we keep that by keeping people in our group young and attracting younger populations, because things do change. I don't know how to run Instagram. I know that's silly, right? With all this education and everything, but that's not something I've learned. And I'm 40 years old. I never used it. So I'm counting on these newer generations to show me these things. And I think you've kept such an open mind and such a mix of people that freshness is always coming in.
My hope is that, like surgeons like you are becoming the CEO of your practice, like, and you are, but I hope that's what Paradigm is enabling. So, because, I don't know probably 95% of how things work within the whole organization at this point, but I know how to like have a vision and sort of connect the dots to get there and find the right people to within the organization or outside to get there. And I'm hoping that's how things are working for our practices. And I think that it is. Like, there's no reason for you to have to know how to use Instagram if you can, like, make the right decision about hiring the right people, or, if you want to implement some digital technology and bring the folks in that can train on that. So has that been your experience to some degree?
Absolutely 100%, not to some degree, 100%. I felt like every step of the way, wherever I was lacking, I was able to reach out. First of all, I'm in Region 3. Our management is amazing. I don't know how else to say it. She was at my beck and call, Michelle. She's at my beck and call at all times, and she directs me to the right place. Whether it's Dr. Forty, whether it's you, whether it's Dr. Yaku. I mean, I've connected with all kinds of people over the United States for mentorship. And whether it's on an implant case or PRA or marketing, or I have gotten somebody to sit down with me, and Dr. Rallis, I'm not lying to you, it's for hours. For hours, people will give me their time, their attention after their long day of surgery or their long day of doing whatever they're doing. Everybody's busy. They will sit down with me for hours to make sure that I understand it and I have a good path forward. And I've found that I have not found that to be lacking in any aspect of opening up an entire practice, which is, to me, unheard of. I've never seen it before.
Thinking about building a team, and I know early on Joe or someone called me and said, I think Dr. Memic's husband would be fantastic to work in the practice. And I know he has a lot of marketing and social media experience where maybe you don't.
Really?
You said it, not me.
Yeah, I know the guy.
And I obviously, started my practice as well with Katie, my wife, and it's been, an amazing experience. And it's, I think it's kind of unconventional, or a lot of people think that it's like fraught with obstacles, but I've just never found that. It's been, I'm busy doing surgery and she's doing other things, but how has that been as you guys are kind of in the early days of building things?
Unbelievable. That's the one word that I have for it. So since we met right before COVID. So we were together for about 3 weeks before COVID.
Oh,
So,
wow.
so it was either going to make us or break us because there was no more dating. There was no more anything. And Germany was locked down. I mean, we were locked down. So we huddled together for a year, all by ourselves. We would paint, we would eat, so we became more than just partners. We became friends. He understood me, I understood him. And he loved the fact that I was an oral surgeon. He wanted to learn about it. So as we both exited the military and kind of got married and had a child and did this whole thing separately from work, he was always my biggest fan. He would want to hear about my cases. He would always want to promote me. He's the one that carried my business cards around. He's the one that, when I exited the military, really found me the job, found me a place to settle down. You know, he knew what I was capable of, and he always believed in me. And so when it was time for somebody to market for me, I really believed in him. I knew what he was capable of. First of all, I know how
Yeah.
intelligent he is and how hardworking he is. But on the other hand, he knows me better than anybody. And he knows that my first love, no offense to him if he's watching, is surgery. My first love is surgery. And he understands that. So when he tells a practice, she'll see your patient the same day, he knows he can mean that.
Uh-huh.
And I don't have to teach him that. It's natural. He knows that about me. So that has been really an integral part of my growth. I feel so comfortable. And the other thing is I trust him. I trust him not to take my name out there and say anything that,
Yeah.
it's hard to trust people, especially nowadays. You have to make sure you trust them before you send them out to speak
Yeah.
for you.
Yeah.
And I have that trust in him. So for me, it has just worked beautifully. Plus, I'll tell you a secret. We do things like in the middle of the night, he'll come up with an idea. And so it's like easy to plan things because
Yeah.
we're always together.
Yeah, like 24/7.
Exactly.
That's great. How is it, building the rest of your team being probably different than the military where you can sort of tell someone they have to do something and they probably kind of have to do it?
Not kind of, they have to. Let's just say I miss those days. It's been, that's where I've seen the most growth over these last 3 months, I would say, for me as a human being, is that I'm used to having control of the situation and explaining what needs to be done and just it being done. But I think to have tact, to have a way you speak to every single employee, you have to speak to them differently. You have to speak to them in an authoritative manner, but a manner that's received, especially when there's an age gap between you or somebody's older than you and you are their boss. I'm sure you experience that all the time as well. So I have really found Paradigm to be very good at developing me in that manner as well, and also supporting me, because getting upset or getting vocal isn't really the right answer when you're in these positions. You have to speak in a certain manner. And Michelle said, well, why don't you just sit down and write it down or call me?
Uh-huh.
Get it out of your system and talk to them tomorrow. I'm like, oh my gosh, is that easy? I didn't think of that. Because, we're so passionate.
Yeah,
It's
I'm the
my,
same way. I'm the same way.
exactly. But that's what I do. I literally sit down, write it down, call Michelle. We talk every night. And then the next day, I deal with it. How hard was that?
Yeah.
Well, now I've told my secret. But that's the kind of stuff that you don't know what you don't know, and you don't know how you're going to react in a situation when you're the boss, right? So Paradigm has really, really helped. The support that you've given me has really helped shape me.
Well, thank you. I love watching people build and grow, and it's the most fun thing I do. I mean, that's where I like to spend all my time, as well, not all, as much time as I can, with newer doctors building things. I love the de novo side of things, and I think it kind of just goes back to my childhood and helping my dad build houses and things. It's what I really, so I've loved watching your practice develop, and you can see the number. I love data. That's kind of like my second love. And you can just see the new appointments. You can just see how it kind of starts to trend, and you sort of know, at least I do, and I should objectify it more, but I can sort of tell when I don't have to even watch anymore, because it's like, okay, that like the plane has taken off.
Yeah.
It's fine. You can totally see that in your numbers and the trends, and it's like, I mean, there'll probably be ups and downs and things, but it's like, oh yeah, this is like kind of off to the races now, kind of based on how busy you are. and I'm sure you would like to be even busier, but you can see it's just set for success. So that's really exciting.
But when I had the phone call with you and you told me, because I said, let me wait for an event, let me wait to form some, let me wait for my open house. You said, there's no waiting. What are you waiting for? Just do it.
Yeah.
I took that to heart, and guess what? I'm getting the tail end of the year. I'm getting all the implants that, other surgeons are too busy to take, or, oh, we always refer to this guy, but he doesn't have any appointments this year, and the patient wants to maximize their funds this year. So I'm catching all of these random things just by not waiting.
Yeah.
There's no waiting. You got to get out there and you got to do it.
Yeah. Oh, I'm so glad you said that, because I've observed that lots of times where people, I say, okay, what is this practice? When are they, having some education event? They're like, oh, well, they're going to do it in September. I'm like, well, wait, why would you wait? Like, it's like time's our most valuable commodity, and you just have to do it. And I was thinking about the other day, I had, I don't nothing terribly wrong, but it just like wasn't the best day. And I was thinking about things, and I was like, man, like, I feel like I have to, like, endure some bad things from time to time. And I was like, well, but I also have a lot of good things too. And it's like usually 3 steps forward, 1 step back. And I realized, like, well, it's because I just do a lot of stuff. So it's like you can sort of start to get down when bad things happen, but then you realize, like, I could just do nothing, and then nothing bad would happen, but nothing good would happen either.
Well, what is the point of that? Yes. So when you told me that, I mean, immediately we said, all right, we're doing a November event. We're doing one more round of going to the dentist. Whenever I have a second of time, I'm outside.
Yeah.
I call Jose. I say, hey, what clinic are you at? Where are you? I'll meet you. I'll help you. I'll say hi. He says, hey, the doctor's going to be here.
Yeah.
Everybody gets excited. You have to use every second of your time effectively if you want results.
And I think, like, from an investment perspective, anything that you can possibly do to do something better for patients, or do more for patients, or something for your referral that will enable their patients to get into you more or faster, like that stuff is, there's sort of no limits to investment there, I think.
Exactly.
And it just works out.
Exactly. So I really took that to heart. And again, I want to thank you for that piece of advice.
Well, no.
Because it's working.
Of course. What have you found to be the most challenging thing the past few months?
I would say the most challenging thing is kind of building processes. With such new staff. So my 2 surgical assistants, they did follow me from my previous job. So they've been with me for about 2 years, which was really nice.
Yeah.
So they know me really well, but they don't know XChart. They don't know the digital system. They don't know, they don't know the processes.
Yeah.
Because with them, I was in a corporate setting where you walk in, do the surgery, you walk out.
Yeah.
And that's it. And so setting those processes and making sure they follow through with them. They're excited about the process. They make sense. They're really happy to do them, and then they forget every Monday, right? So it's that constant reminder. And what's invaluable there is 15 or 20 minutes of your time every day. That's it.
I love that you just said that that they were in a corporate structure. I love that like doesn't even connect with, because I don't want to think of us as a corporate structure. I love that you like, well, they were in a corporate structure before, so they just kind of had to do things a certain way. And I think that's what we're focused on, or hopefully doing, is be a clinical model, because maybe within general dentistry or physician practice management or hospital administration, maybe some types of doctors are sort of built to be sort of managed or supported, but I don't think oral maxillofacial surgeons are built to be managed.
In any aspect or I would agree.
I think it's, we should be helping innovate, new clinical techniques and technologies, and applying data and educating one another, and, thinking about ways to develop value for patients, but we shouldn't be managing surgeons.
I agree.
So,
I agree. And this is definitely not the place to get managed.
Yeah.
It's just not. There's too much freedom for that, and too much freedom of thought. And so if somebody's looking to be managed, I don't know. I just don't think it's...
They're probably not an oral surgeon in the first place.
Oh, true. They're probably
maybe a few.
maybe in a different position. I don't know. But yes, implementing those processes, which is essential for success. And I love, even at this conference that we're having, this is process-based. And I think as a surgeon coming to one of these conferences, it's not necessarily for me to memorize codes. I don't necessarily have to memorize codes. It would be cool to know a bunch of them, but I just don't think I'm going to do that. But it is to see these processes and to see the thinking of the staff. What are they thinking? How are they implementing? What are the challenges of implementing this? Because again, when I mention a process, everybody's very excited to implement it, but maybe they're having challenges that they just didn't mention to
Yeah.
me.
Yeah.
So maybe that's why they're not doing it. I don't know. So again, with this company, you have mentorship for all aspects of the practice. And I think that is brilliant.
Yeah, I think we're teaching people things,
Yes.
teaching people principles and ways of doing things, not absolutes.
And teaching them the why.
Yeah.
And to me, as a human being, the why is very important. If I understand the why and I halfway agree with it, I'll do it. If I don't understand the why, even if I agree with the concept, I'm probably going to forget to do it half the time.
Really, we were talking about patient storytelling, and I hadn't really kind of thought about it that way, but maybe talk a little bit about that.
Sure. So that is one of my principles, if you will, is let my patient tell my story for me. Right. So I can't reach every single patient or every single potential patient. It's not possible. I can't go to people's houses and talk about myself. If I could, I'd probably have a pretty good patient base. But if you provide great service for a patient and provide them with a great surgery and a great experience at your practice, that patient is going to be your biggest fan and is going to be your loudest voice to project you forward and to bring you more patients. That story is important because that story is real, that story is authentic, and they just lived through it. And so all of their friends, all of their colleagues, all of the kids at their kids' school, everybody wants to hear the story and they're going to hear it. So I love Google reviews and I love, social media and I love websites and I love all this stuff, but I think patient stories are our biggest asset.
So, what's happened over, from 2 months ago where you were getting 1 or 2 new appointments a day to, I think I saw one day last week you had like 11 new appointments.
Yeah.
Like what do you think what happened? Like what was the experience? How did that transpire?
You may first want to ask me, how did the clinic handle it?
Yeah.
They said, this is great, but we're really busy. I said, oh, we're going to get busier, people. Right. So one thing is I have actually already had patients come in that say, hey, my friend got his tooth out with you 2 weeks ago, and now I'm here. Or they'll bring in a referral for another practice and say, my friend told me to go here instead. A nurse at Emory came in 2 or 3 days ago, and her friend, who was her escort, when I called for the post-op call to see how she's doing, she said, she had so much fun, I'm coming in for my tooth.
Yeah.
Right?
Yeah.
That's what I'm already seeing.
Yeah.
And I call Buckhead a small town.
Yeah.
Everybody talks to everybody. Everybody talks about everybody. So you got to be careful with that because if something bad happens, everybody knows about it. Yeah. But as long as you keep your standards up, I think that your work can speak for itself through your patient. Second thing that's really happened is the marketing aspect. You have to have somebody who goes out to these offices and provides face-to-face contact and schedules a time, either brings you along, calls you all the time, texts you all the time. I mean, Jose will text me and say, hey, this doctor really wants to meet you. You have to go see her. You have to spend 10 minutes with her. And we make it happen.
Yeah.
That face-to-face time of doctor to doctor, or even doctor to front desk, doctor to manager, or marketing to marketing. When he walks into an office, they say, hey, Precision is here. Right? So to get my name out there, to get my brand out there. So those two things have been happening in tandem. A great patient experience coupled with a very fierce marketing front. Have really taken my practice to the next level already. And I am so excited to see what happens over the next 6 months because I want to sit down and really analyze it. Because I think we're going to see some fabulous stuff.
How has it been, being a mom and a surgeon now?
Oh, why would you
and
ask me that?
And opening a new practice.
Why not, right? Do it all this year. So my baby's 1.5 years. So with my previous corporate job, I was traveling actually 2 hours from home every single day, 2 hours there, 2 hours back on average. And so really did not have family time, not because I didn't want it or not because necessarily it was a time issue, because I would try to get off work by 3 and do all these things to try to spend time with my child. But I was so tired. I was so tired. And so I didn't have quality time with him. Now I have actually created a little balance in my life. I know. But I can actually pick him up from daycare. I can spend quality time with him. I know marketing is taken care of. I know what I'm walking into the next day. I can organize it in such a manner that it makes sense for me, because I know you're not a mother, you're a father. It's very similar, but it's different. Being a mother is a whole nother level of anxiety about that little child that, you for some reason in your mind, you think they're going to die without you. Eh, I know that's not true, but
Yeah, yeah,
that's how you
no.
feel all day long, every single day. So to be able to create that balance and to spend a little bit quality time with him has changed my entire life.
Uh,
This is possible. This is possible to be a great mother and to be all in the practice
yeah,
aspect.
yeah, it's inspiring to hear that and see what you're doing.
It's a big deal. And I know I've gone through residency as a woman. Obviously, I worked in the corporate setting as a woman. I was in the military as a female. This is the only place, Dr. Rallis, and I mean this from the bottom of my heart, where I feel like I have a seat at the big boys' table. And it's okay that I'm a woman, and it's okay that I'm a mother, and it's okay that I am who I am, and I can show up with my little makeup or whatever and still have a seat and be taken seriously. And that culture is something that we have to preserve.
Yeah, well, you've more than earned the seat at the table.
Oh,
So,
thank you.
I think,
But you just don't get it in other environments. So this has been so refreshing for me.
well, thank you. What are you most excited about? What does the future look like?
I'm most excited to build this thing and just see what's out there, what's possible, what I'm capable of. I'm excited to connect with mentors. Okay, and I've already mentioned a couple of surgeons already that I've kind of hitched my
Yeah,
star on, and I said, "Hey, listen, I'm gonna do what you do in Georgia. Is that
yeah,
okay?" Oh, absolutely. Let me give you the name of a book. This is what Dr. Arsen out today, 15-minute conversation. Let me give you the name of the book where you can start a second book when you're done with that first book. Let me give you my protocol. Let me send a picture of a bunch of my cases and then share a case with me. And I also have a class I'm giving you're coming to. Thank you. I didn't pay this guy. The guy met me for 15 minutes, and this is what he offered me as far as mentorship. This is the type of mentorship that I'm talking about giving to our future surgeons.
yeah.
You cannot find that anywhere else. I have looked. You can't find it anywhere else.
Well, I think we have a team of leaders basically
Yes.
amongst all of our surgeons, hopefully. But I know, just how the structure of our organization is aligned and things. I think it really promotes doctors, working with doctors, mentoring. I know, I could countless doctors, but I think like Dr. Ryan Cho, you've
Oh,
worked with some, and
I can't believe I forgot to mention. I'm sorry. Dr. Ryan Cho is the one that helped me create my whole marketing. I call it a marketing campaign because there are so many aspects to marketing, right? There's the face-to-face marketing, there's digital marketing, there's event, there's just a lot going on. And he sat down with me and gave me a 2-hour rundown of what a lunch and learn should look like and what it should entail. He gave me a copy of his lunch and learn lecture. He gave me a whole protocol for it. I'm telling you, we have done 5 lunch and learns. Those referrals are pouring in. The lunch and learn is what you don't have to call it a lunch and learn so you don't intimidate anybody. Oh, we don't have a full hour. We can't schedule it. No problem. Do you want a 30-minute lunch and learn?
Yeah.
You guys do a 30-minute lunch and learn? We do a 30-minute before the day starts. We do it after the day starts. Hey, if you guys have a day that a case cancels, a big case, let's not ruin your doctor's day. I'll come bring food. I'll make the doctor happy and I'll give you a little lecture. Right. There's no.
Yeah.
You figure out a way to get into that office, but that 15, 20, 30, I can speak for 10 hours. If they wanted it, they don't want it. But whatever time they'll give me after that lecture, I'm telling you, the whole staff has a different attitude about the surgeon. They feel like they can pick up the phone and just call me, which they can, but they just don't know until they meet me. So those have been invaluable.
Well, I'm excited to connect the doctors over this next year that are doing, something similar to what you've done to sort of have you as a mentor in that
Oh,
process.
absolutely. Well, you already know, but we're doing region groups now as well, where there's a mentorship of more senior doctors and more junior doctors, and we get to just share information
Yeah.
on a little group chat. How simple is that?
I think the interesting thing is some of the more senior doctors maybe aren't even chronologically older.
No,
It's
no,
just someone who's done something for a few years. It's like I really love like our culture of, sort of like I talk about as meritocracy. It's like
absolutely.
you might be teaching, like you said in practice, you might be, instructing someone 10 years older than you or something.
Right, which
That's
is
kind of cool.
challenging, but it's possible.
Yeah.
Why not? And why can't we all learn from each other?
Yeah.
But think about it. Think about yourself when you graduated residency. Now, maybe you graduated a whole rock star, okay? I was scared to death. My first sedation, I'll never forget it. I
Yeah.
said,
Yeah. No.
I've done this for 5 years now. I have no idea what I'm doing.
Yeah,
Right? Because
it's very scary.
you're on your own. I was by myself in a clinic, by myself. There was nobody around. Well, my 2 assistants and me. But the 2 assistants are just straight soldiers. I trained them, right? So whatever they know, I already know. They can't help me, right? And that was my first sedation. And so I'm thinking, my gosh, if I had a whole class of people who I could just contact, who could help me, my first implant, who I can just lean on to say, hey, can you look at this CT, my first full arch? I mean, you just kind of figure it out on an island by yourself. In Paradigm, you don't have to do that. You don't have to do that. And I think I keep saying, I just don't think you can find that anywhere else.
Well, I hope not. Or, well, I kind of hope that other people do a great job too,
I know.
but I hope we're differentiated.
We are. We are. I mean, coming from my perspective, I just want to tell you these things because you don't know,
Well, thank you.
right? I mean, how would you know?
Yeah, no, that's incredible.
You know what we should do? Have you started a novo somewhere? Just to
Yeah.
test your water.
See if I still know how to do it. No, I'd love to do that. I think about that all the time.
Oh, gosh, don't think about that.
But
I'll tell you everything. How about that?
I'm a little bit scheduled for a bit here.
You're a bit busy.
But no, I kind of get to open or help be a small part of opening a lot of de novos. So
Yeah.
that definitely scratches the itch, I guess.
There you go. There you go. So a lot of plans for the future.
For new practices, yeah. But I think we've got, I don't know, 26 or something that for next year, maybe 28. So it's just kind of become like a snowball. So much of this is never, didn't, well, I kind of secretly planned it all, hoping that it would, but it probably didn't.
A dream. It was a
Didn't
dream.
really tell people exactly what we thought could happen. But certainly tried to put the pieces in place to make it happen. And it's I think that the thing that surprises me most has been able to attract people like you and Hamza and Ryan and just the enthusiasm that you all have to just do more for patients. And I think maybe we sort of the principles or philosophies or mission of the company, maybe in some ways they sort of resonate with people that have had to overcome a lot of challenges and things, and just kind of a goalless thinking approach of just how can I do more. And obviously when you only had one tomato to eat, you had to do a lot. I mean, it was critical to failure probably wasn't really an option for you.
No, it was not. We had to make it. But that's why we came to this country. We came for, I mean, I know this is going to sound cliche, but we came for the American dream. And then here it is again in front of us, giving us, that's all I want, a seat at the table, the opportunity, and I'll make it happen.
Yeah.
And I think, yes, you are attracting that type of person. That is absolutely true. That's what you want.
Yeah. Oh,
That's what you want.
absolutely.
That's how you can multiply your efforts. And you shouldn't be this busy at this point. We should take everything off your hands. You should just be sitting there like a king,
No,
right?
no, I would not like that. I would not.
No, you're a busy bee. But all I'm saying is that's how we can multiply our efforts, and we can multiply helping people. And like Dr. Arsenault said, we can change the world one tooth at a time, literally, by giving people a better quality of life. Who wants to walk around with a flipper at the front of their mouth or the back of their mouth?
Yeah.
I mean, who?
Yeah.
Why? I wouldn't allow my mom to do that.
Yeah.
So why would I allow a patient to
Yeah.
do that?
Yeah.
It's that simple. I think our job is that simple. And I think the fact that we're oral maxillofacial surgeons just gives us, I was just talking to Dr. Arsenault about this. We are in a profession that we restore something that's the most used in the entire
it's
body.
It's the most personal. It's your smile. It's your
Exactly.
face.
It's your identity.
Yeah.
Right? How would you smile if you didn't have your front teeth?
Yeah. Not very well.
There's no way you would crack a smile or a grin or, ha, ha, ha. No way. Even if it's in the back of my mouth, something's missing, I'm going to feel some type of way about it. Now, when we talk about disease control and what the implications it has on the rest of the body, when we're talking, just an example. I'm sorry, I'm taking over, but I got to tell you this.
I love it.
I am so passionate about this. I went through the highest quality in Buckhead, highest quality OBGYN care you could possibly find. I'm talking about a surgical suite to deliver my baby. I'm talking about a personal chef. I'm talking about, it was a one and done, so I wanted the whole experience, right? No one ever mentioned my mouth.
Uh-huh.
Not a single time. Not a single time about disease prevention, about the child's mouth, about my mouth, about nothing. That is a huge population that is so underserved. The dentist won't even touch a pregnant patient.
Yeah.
You know?
Yeah. Oh,
There's
yeah.
that's just one little subset of the population that hasn't even been addressed. Now, how many populations can you think of that are like that?
No, it's so, I don't understand. I guess it's historical and how the educational pathways developed and things, but it just makes no sense how the mouth has been devalued, relative to the rest of the body. And I've said it tons of times, but this, oral systemic link, I think it's the most indignified term to even say oral systemic link. Like, why do we have to say that?
Right.
Like, no one talks about their kidneys being connected to the rest of their body. We just sort of give that credit.
Yes, like, we know you do your job. Yes, but that is the kind of stuff that I envision for the future. I don't just want to be a worker, be somewhere, and make a bunch of money and be happy. That's not what I want.
Yeah.
I want more from this profession. I want more for our profession. So that is one of the biggest reasons why, as soon as I came to one of the meetings for Paradigm, I was sold. I was sold on the concept, on creating a healthcare system for the face and the mouth.
I love that. I think that that couldn't have summarized it better. Developing an organization that attracts people like you and amazing talent. I mean, that's what it's going to take to really. Who knows what our future will be, but to do something really special that we're all super proud of, because we'll all have great jobs and do lots of surgery. But what's next? What's our next big thing? That's what kind of keeps me going.
I agree.
And is super inspiring. And when I was at Mayo, I mean, part of it is, I observed what care was like there. I mean, it was amazing. They have every resource in the world and see thousands of patients, and the patients are all, absolutely convinced they're seeing the best doctors in the world, and they are. But I realized, like, that kind of ended when I left Mayo. Like, that wasn't going to be the typical scenario in dentistry or oral surgery, where we're a bit more resource constrained, at least in the typical model. So I thought that's, for an independent practice, I'm probably never going to practice quite like I
Right.
am right now. And if I go into a corporate world, I'm not built to be managed. And so that's where I sort of had this idea of Paradigm. And I think that it's, you're like living proof of that working, I think, and that we're developing resources to really take people like you with tremendous talent and launch you to your fullest extent, hopefully.
Absolutely.
So I think this has been amazing conversation. I think you need to start a podcast.
No, I'll just visit yours.
You got enough going on. We'll wait till next year.
Deal.
But well, thanks, Mirela. It's been a
Thank
pleasure.
you for your time, and I'll see you soon.
All right. Thank you for joining us on the Paradigm Concept. We'll see you again next time.